Thank you, Madam Deputy Speaker. The government came into office making all the right noises about tackling waiting lists and delivering a better healthcare service, all things that our constituents want to see. However, since their election, I'm concerned that ministers are giving out more money, about £22.6 billion for the day-to-day running, to the NHS, but without plans for how this may be spent to reform our health service, make it more efficient and support priority areas like dentistry, general practice or hospice care. The government is seemingly giving with one hand but taking with the other. No one should underestimate the impact of the increase of the employer's national insurance contributions on our GP surgeries. Both Toaster and Brackley Medical Centres in my constituency have said that this increase would cost at least £40,000 to £50,000 and may result in redundancies and stopping the growth of their practices. Our surgeries are not here to make profits, but to deliver care, and attacks like this make care unsustainable. This is at a time when the Darzi report said that the NHS budget is not being spent where it should be. Too great a share is being spent in hospitals, too little in the community, and productivity is too low.
Will she give way on that point?
Of course.
I mean, I thank her for giving way, and I once again agree entirely with what she's saying. But has she seen anything from this government that suggests that there is going to be a significant shift from acute care in hospital to community care, despite the rhetoric that we've heard from the other benches?
I thank my honourable friend for his intervention. I do concur. I haven't seen anything, which is why it's so important we have this sort of debate today. Indeed, my GPs are actually telling me on this point that more attention does need to be given to GP practices. These are the Praetorian Guard who can ultimately protect the NHS. Access to timely appointments is crucial, as is rebuilding the key relationships and contact between a GP and their patient. Of course.
Under the last government, we had 20% of NHS doctors thinking about moving overseas. Surely solving the GP contract is a first step to keeping GPs working in this country.
I thank my honourable friend for that, and indeed, and I want to encourage all our GPs to be remaining within the UK and giving back to what they do. So everything that we can do in that regard, I'm always fully supportive of. But also on this, I'll make some progress if you don't mind. Also on this point, this is also reinforced by the Committee of the Public Accounts report on the NHS financial stability from January this year, which concluded that a reallocation of funds was needed to focus attention from sickness to prevention. Now, I am a massive advocate of prevention. Many members will know that I talk about being a type 1 diabetic, and if a member hasn't heard me talking about it, they may have heard one of my sensors going off for a low blood sugar. But there is so much that we could do in preventative measures in the treatment of diabetes. These treatments can be expensive as an initial outlay, but they will solve so many long-term problems. We cannot prevent type 1 diabetes, but, for example, we could have earlier testing in children so that we could avoid them being diagnosed when in a state of diabetic ketoacidosis, which can be fatal. Families can be prepared and ready and avoid hospitalisation, therefore saving costs to the NHS whilst also saving lives. We can also ensure access to technology which can avoid the huge complications. Poor blood sugar control can result in loss of eyesight and limbs alongside heart and other conditions. Making continuous glucose monitors and even insulin pumps available across the country can significantly help the patient and, again, in the long term, save the NHS money. And at the moment, it is a very unfair postcode lottery. So I ask the ministers to consider ways to tip the funding balance to ensure that both prevention and community care measures are funded properly. And a final point. Any reforms to the NHS must consider the computer operating systems in place. Many of my constituents have to go out of the constituency for their hospital care, be that to Northampton, to the John Radcliffe, Horton, Milton Keynes or Kettering hospitals. But all those trusts operate on different systems, meaning that my constituents often cannot have their scans or medical notes shared easily. This is frustrating for residents, but also potentially fatal. One resident noted that his wife was nearly given a drug that she was allergic to because her notes had not been able to be shared correctly, and it was only his presence that saved her. We must ensure that money is spent to look at this and change the systems, and that has been explained by the member for the North Cotswolds very conclusively. We owe it to our constituents, Madam Deputy Speaker, to work across the House to better our healthcare and support the fantastic work of our doctors and nurses. Thank you.